Welcome to topic 4, where we are going to evaluate image of shoulder using Paceman method. This is a projection of epi-shoulder which there is glenoid fossa is visualized. Superolateral border of scapula seen without thorax superimposition. Posterior portion of glenoid fossa superimposed with medial margin of humeral head. Superior scapular angle superimposed with mid-clavicle. Glenohumeral joint space and coracoid are at the CCF and include lateral 2/3 of clavicle, proximal 1/3 of humerus, and superior scapula. There is external rotation to this epi-shoulder because epicondyles parallel to film. Greater tubercle and humeral head in the profile laterally. The vertical cortical outline of lesser tubercle halfway between greater tubercle and humeral head. To correct this, internally rotate the arm until humeral epicondyle are perpendicular to the IR. Next, we have alignment. X-ray tube and part positioning must include the superior border, lateral border, and anterior border of the body. X-ray tube and the image receptor must be centered and aligned. Image receptor and part positioning must be at the center of the table and overlap with other center. The centering point for this projection is at 2.5 cm inferior to the coracoid process or 2 cm inferior to the lateral clavicle at the level of glenohumeral joint. Next, we have collimation. The structure shown must be including superior border, inferior border, and lateral border. Collimate from superior scapula, lateral 2/3 of clavicles, and proximal 1/3 of humerus. For lateral, including lateral skin margin. Next, we have exposure. The KVP used is adequate for penetration and radiographic contrast. The bony cortical outline which show the thin structure which acromion are shown, and the thick structure which the coracoid or glenoid fossa are shown. The MAS used is adequate for penetration and visualize. The bony trabecular pattern which shown the thin structure which acromion shown, and the thick structure which coracoid or glenoid fossa also shown. Next, we have marker. There is no marker identifying the correct side of the patient is present on the image. To correct this, put the marker on the right side of patient shoulder but not superimposed on region of interest of body part. Next, we have aesthetic. The film size used is 18 × 24 cm lengthwise is used. The glenoid fossa, superolateral border of scapula, humeral head 2/3 of clavicle, and proximal 1/3 of humerus, and bony cortical outline are sharply defined, showing no body movement, correct respiration, and correct OID and SID. No evidence of preventable artifact shown, such as necklace. Last one, we have name. Patient's ID, name, date, facility name are not stated.